everybody, I'm Justine, and today we're going to be going over schizophrenia. What it is, how to diagnose it, some signs and symptoms, treatment options. So on this first page, we're just going to go ahead and dig right in. So what is schizophrenia? It is a psychological disorder that seemingly affects every aspect of somebody's life who is suffering with it. They may have hallucinations, some faulty perceptions of reality, lack of social skills. When you look at this middle number right here, it says 1.2% of Americans. So that seems pretty low, but when you look at the number as a whole, that's 3.2 million people in America who are diagnosed and living with schizophrenia. So when you think of schizophrenia, you typically think of the crazy person running down the street, screaming obscene things, or somebody hallucinating. But there are both positive and negative symptoms associated with schizophrenia. So on this next page, I'm going to go over the positive symptoms as well as the negative symptoms. The positive symptoms are inappropriate behaviors, both psychological as well as physical. So the agitation, vivid hallucinations, disoriented thinking, shakiness. Where the negative symptoms are the absence of appropriate behavior. So instead of feeling emotion, somebody suffering with schizophrenia may be emotionless. They may have rigid movements, mutism, or the refusal to speak. And if they do speak, they're probably going to speak in a flat or monotone voice. Somebody living with schizophrenia typically keeps to themselves only because they are so caught up in their own delusions. So this diagram right here kind of goes over the positive and negative symptoms, where somebody with schizophrenia may have super high highs where they're delusional and they're having crazy hallucinations and disorganized speech, to the next minute being completely muted, or the flattened effect as they call it. So somebody with schizophrenia is kind of all over the place. How to diagnose it? So unlike other illnesses such as cancer or heart disease, diabetes, those can all be diagnosed through a series of lab work or blood work, where mental illness as a whole, you can't just gather somebody's blood and diagnose them. So your first step will be going to your physician, and they'll do a complete physical on you, including blood work and urine analysis, just to kind of eliminate any underlying illnesses. If none are present, then they'll refer you to see a psychologist or a psychiatrist, somebody who specializes in mental illness. Once you get there, they're going to go over a questionnaire with you with a series of questions, some signs and symptoms you've been experiencing. After all of that is kind of worked out and you've been experiencing it for at least 6 months, then they'll give you your official diagnosis. So treatment options. There's both the pharmaceutics as well as therapy that you can use while treating schizophrenia. Using them both together, drug therapy as well as therapy itself, you will have a 60% success rate. Treating schizophrenia, though, is a long-term process, so you can't just stop your treatment once you start it. If you do stop it, you have the chance of falling into a severe schizophrenic state, and that will happen to about 80% of those people who are suffering if they stop their treatment. Moving on to non-drug therapy options. So you can do psychotherapy, some personal therapy, social skills therapy, which will help you interact with people, vocational sheltered employment rehab therapy, get you back into the workforce in an appropriate way, where drug therapy options are something that we're probably more familiar with. You have your antipsychotic agents for maintenance therapy, or a mood stabilizer that they may put you on as well. So when it comes to nature versus nurture, most people think you were born with schizophrenia. And while that is partly true, it is a gene, nature and nurture both play a role in it. So researchers have done studies and suggest that while one may be born with the gene that schizophrenia is responsible for, environmental factors play a large role in triggering it as well. So the likelihood of developing schizophrenia is pretty low if both nature and nurture don't play a factor. Psychology in general. So before this course, I wasn't too interested in it. I hadn't taken any psychology classes at all, but after this course, I really hope to continue learning and expanding my knowledge. So after this degree, I want to go back for psychology. To me, the brain is just so fascinating, and this class has taught me to be empathetic. While our brains are fascinating and powerful, it's often hard to fully grasp what somebody may be battling internally just because it's invisible to the eye. So I think diving in and learning more could really just set me up for success. And so I'm really looking forward to all of